Moving along here on a Thursday, it's the Joel Natale Show live from our Kingdom Financial Group studio here at 5th and State, also live on YouTube and Facebook. And, you know, our next guest comes in with a WWE type belt. And, yeah, you can show it right in front of the camera there, Alivia. Alivia Haibach is with us. She's the Chief Executive Officer of the Mheds. And they're having their Amazing Pepperoni Ball Race coming up here this Saturday. Well, welcome to the show.
Thank you. Thank you for having me on.
Let's do an origin story. Did you grow up around here or did you transplant in?
I grew up in Northeast. I did my undergrad in Allegheny, lived overseas for about a decade. And then when my husband and I started having kids, we moved back to Erie.
Where'd you live overseas?
I've lived in China, Bahrain, Saudi Arabia, and Egypt.
Oh, my goodness. Wow. Well, welcome back to Erie.
Thank you.
And tell us a little bit about Mheds.
So Mheds is really Erie's healthcare home for Erie's refugee and immigrant population, as well as anyone else who needs access to high-quality healthcare but maybe lacks the ability to pay. Our mission and the mission of any federally qualified health center is to serve everyone in our service area, regardless of their ability to pay, and that's what we do every day.
So you have like a contract with the U.S. government, or how does that work?
We have a status with the U.S. government.
Okay.
So we're a federally qualified health center lookalike, which means we meet all of the same rigorous compliance standards of a federally qualified health center, but we don't get the annual grant funding. So the annual federal grant funding. So we rely on patient visits and grant funding from the state and from private donors to serve our mission.
Do you kind of charge like a sliding scale? Or?
We do have a sliding scale fee. So for folks who have insurance, Medicaid, Medicare, and then a number of private insurers, it's like going to see any other doctor. Mm-hmm. If you don't have insurance, we have a sliding scale fee. And if that's cost prohibitive, we either waive the cost of service completely or we have a very small nominal fee, $20 for the visit.
Do you feel like you're focusing on primary care, kind of filling those gaps, or is it more that you're more focused on the populations, so you're able to provide special services or what have you?
So our group has a lot of primary care clinicians. We are a primary care doctor's office, but what's neat is that we're also able to offer chiropractic care in-house, and we employ behavioral health clinicians. So some folks will come in, they'll see their primary care doctor, they'll have a visit with the counselor, maybe they see the chiropractor. We really like to remove barriers, and we recognize that transportation is one of them. So if we can address as many of your health needs as possible in one visit, we're going to.
So tell us where you're located.
We have 3 offices. We're at 2928 Peach Street, 826 Parade, right next door to Krause's department store. We're celebrating 1 year at that location tomorrow. Wow. And we're also in the basement of the JFK Center. Oh,
well, yeah. So kind of easy to get to.
We try to be.
Yeah, I mean, as far as on the bus lines, able to walk to, mm-hmm. and so on, and so. You said that you do depend on the generosity of donations and things, and that's kind of what brings you here today, right?
Well, I'm really here today to talk about the best event that's ever happened in the history of Erie, Pennsylvania. And I'm not sure enough people are aware of it.
I love it.
So on Saturday, we're hosting the first inaugural Amazing Pepperoni Ball Race. If you're similar with the concept of the Amazing Race...
Okay.
It's a scavenger hunt throughout the city. Teams of 4 will arrive at Voodoo Brewery before 1. That's when the kickoff starts. You'll get a clue. You'll have to figure out where you're headed. You'll get to your first location, eat 2 pepperoni balls, complete a very challenging challenge like a game of Connect 4 or winning a staring contest, and then you get your next clue. There's 5 different race stops, and the winning team will receive a prize of $500.
Oh, my goodness.
I know. You should sign up.
Wow.
I don't know what you're doing Saturday, but...
I don't know either. I'm just dealing with this 24-hour period.
Get a team right together.
That's astounding.
Yeah.
So what's been the response to this?
People, okay, it's been a little mixed. I think people are a little confused.
Oh, okay. Well, let's get rid of that confusion.
My younger sister is an incredible runner. She ran for the proud Northeast cross country tradition was
the
carried out
grape
in my
pickers,
family.
yes.
Yeah. So my sister ran all state cross country. She still runs as an adult, and she's
What was
like,
it? Coach Cooper, I want to say?
Coach Miller.
Coach Miller, that's what I'm thinking
Yeah.
of. Yes, I'm sorry.
And
yeah.
so she asked me, she's like, is this a race that can I run in this? I said, no, this is a scavenger hunt. So we're not.
We don't
not
need you to
asking
speed down
run
the
around
road.
the
Yeah,
city. In
yeah.
fact, please bring your vehicle. We need to drive between the race stops. They're not
Okay.
close enough to run. But overall, people are pretty excited. And the reason I'm going to show this off again, it's actually very heavy.
Yeah,
Because-
best pepperoni ball. It is a legit belt.
It was an investment on our part.
Yeah. Let me read it for the folks. Best pepperoni ball champion 2025 Erie, PA, presented by Mheds. Oh my gosh.
So, if you don't want to participate in the race or you can't, maybe your afternoon's a little busy, at 3:30 we kick off the pepperoni ball cook-off. We have 10 different local restaurants coming to Voodoo. 3 celebrity guest judges, which I'll keep a secret for now, but it's going to be pretty good. And they're going to try all the pepperoni balls. And the winner of that gets to take home this amazing belt to their restaurant to hang up for the year. And I think there is a lot of discussion about who has Erie's best pepperoni ball.
Well, I'm really I'm kind of dumbfounded because Alivia, I thought all pepperoni balls were the same.
Oh, are you from here?
I remember you have pepperoni balls and you have pizza balls. That's the only. So there's different takes, huh?
There's the dough to pepperoni ratio. Are we adding cheese? Are we not adding cheese? What type of bread are we using? Are you real creative? We're getting a sourdough in there. What kind of frying mechanism are you using? Are you baking? The possibilities are endless.
There's
really.
endless possibilities.
And this is why we need someone to settle this question for us.
Wow. Well, that's astounding. All right, let's figure out how folks can get involved with all this. So
Okay, so if you go to mhedsmeds.org, you can sign up. It's not too late for the Great Pepperoni Ball Race. Every team has a chance to win, but I would say that everyone is a winner because you'll get one of these phenomenal pepperoni ball t-shirts.
They're really cute. Yeah.
I designed it. It's pretty
nice.
good. Yeah. And then if you can't make it for the race, but you want to come on down and see who will win at 3:30 on Saturday, come to Voodoo. Help us crown the pepperoni ball. And I like calling it the pepperoni ball because I love puns.
Right.
Help us crown the champion and let them take home their belt. So that's how we get involved.
The victorious one. I love this about the again. It's a really, really fun event. Very serious and important function that Mheds does here, because not only are you available for all those different medical cares, but the populations that you're focused on. You say you're an essential partner with those that are involved in the refugee resettlement community, right? With Catholic Charities and MCRC and USCRI. I mean, this fact here: 80% of the medically fragile refugees resettled in PA over the past years picked Erie because of your work. That's something else.
We're really committed to making sure that everyone has the opportunity to live a healthy life. That's why you'll see over 90% of our patients are best served in a language other than English. Over 85% of my staff speak a first language other than English. We actually have more native Ukrainian speakers on staff than native English speakers. Because when you go to the doctor's office, part of a comfortable visit is seeing people who look like you and who understand. Because there's deep cultural traditions that sometimes are difficult to explain, but if you grow up with it, you understand it. We see patients who may have not seen a doctor for 10 years.
Wow.
And so when we're talking about chronic medical conditions, like untreated heart disease for 10 years is quite dangerous. Uncontrolled diabetes for 10 years is very, very dangerous. And so our providers are very skillful, because you kind of get dropped in the middle of an adult's health history and you're like, all right, what can we do to make sure that we're preserving function for as long as possible to make sure people have an opportunity to live a healthy life. But there's a lot of work to do. My office at 2928 Peach Street, the life expectancy is about 82 years in that census tract. If I get in the car and I drive to 826 Parade, it takes me about 10 minutes because I don't speed, City of Erie Police. I lose 10 years of life expectancy.
You're saying on the Lower East Side, it's 10 less years of life expectancy.
10 years of life expectancy
Wow.
based on being born in that census tract, living in that census tract. Because I think as a community, we need to reckon with the fact that we don't always have adequate access to healthcare. And one of the largest barriers is financial. And so organizations like Mheds really are trying to do something to shrink that gap. People shouldn't die sooner because they don't have enough money to see the doctor.
I mean, Alivia, you know the narrative is we've got 3 hospital systems. We've got all of this healthcare. Mheds and Eds is one of our most important economic segments. People would be blown away to hear that statistic.
And those systems are so critical. We work so closely with our hospital partners. We work really, really closely. I recently spoke to the ER residents at Hammett because they want to understand more about the work we do. But primary care is essential. And 75% of your health outcomes are happening outside of your doctor's office. And so we need to be serious about what our communities look like, about how healthy our communities are, about whether people have the opportunity to live healthy lives. If you live in a neighborhood without a grocery store, without proper facilities to get a workout in, without transportation, without a doctor's office, it starts to get pretty challenging to tackle chronic disease.
Wow. Well, you're doing amazing work there at Mheds here. And again, having some fun and raising some money this Saturday, starting and ending at Voodoo, right?
Absolutely.
Right there on State Street.
Yes.
All right. Again, if people want to get involved, what's the best way to do that?
Go to MHEDS, that's meds.org, and you can sign up online. And that's really the best way to get involved with this event.
All right. Well, I'm glad that we made this connection. I hope you have an amazing time on Saturday. And again, amazing work. Congratulations on all of it.
Thank you for having me on.
You got it here. It is 14 in front of 4 o'clock.